I think it's very important that we kind of get back to basics to talk about why we're here. We're not here just to debate several provisions of this. We're here to debate in a larger sense whether or not we're going to pass a children's health insurance bill this year, this month, or not. That's the fundamental debate we're having. We had the opportunity in 2007 in a bipartisan way in this, here in the Senate to achieve a rare and frankly unprecedented bipartisan agreement on a significant piece of legislation, the result of which would have been, over a 5-year period of time, to ensure 10 million American children. I'm not sure any other generation of Americans have had that opportunity. We had a bipartisan consensus here in the Senate. It approached 70 votes, in the high 60s every time it was voted on. A veto-proof number of votes, majority. It went to the House, of course, and the House debated it, and they had an overwhelming vote there, bipartisan vote in the House. It went to President Bush, and he vetoed it twice. Then it came back for an override, and we were able to override it in the Senate, but in the House they fell short. That's where we are. So because of the actions of President Bush, that bill never became law. So now we're back to debating whether or not this Congress is going to provide health insurance to not just 10 million now, it's more like 10.6 million American children. We're either going to do it or we're not. All this other stuff is interesting to debate, and we'll continue to debate it, but we're either going to do it or we're not. Let me just give you one example of what this means. Forget all the numbers for a second and all the programs and all the quibbling about some points of conflict. And we'll address those today, and I will as well. But let's just get back to the basics. What this legislation means to a family, for example, is this. Just give you one thing that happens as a result of this. Millions of American children, if we do our job here and get this passed, and if the House does its job and passes this, millions of American children will have the opportunity for all kinds of good health care provisions. A lot of them preventative in nature. You know, we have a lot of discussions in this body where people talk about the workforce and growing the economy and building a stronger, skilled workforce in the future. None of that means much unless you're going to do this, okay? A child will not develop, they will not achieve in school, and they will not be productive members of our workforce unless we pass legislation like the Children's Health Insurance Bill. I'll give you one example, child visits. Anyone who knows anything about child development, I don't consider myself in any way an expert on this, others may, but we all know as parents, forget legislators or experts, as parents, we know how important it is to have a child go to the doctor a couple times, at a minimum, several times in their first year of life. It's a key time for parent and physician communication. Doctors recommend 6 in the first year of a child's life. Now, with this legislation, we have an opportunity to guarantee that millions more children will see a doctor 6 times in their first year of life. That's something we ought to do. They get a complete physical exam. Height and weight and other developmental milestones are measured. Hearing and vision is checked. Important topics like normal development, nutrition, sleep, safety, infectious diseases, and all kinds of other issues are discussed. General preventative care. Now, if we allow some of these discussions and debates today to bog this down and not get it passed in a bipartisan way, what we're preventing is, among other things, is millions of children will not get this. Simple as that. So those who are going to use these other things to put in the way as impediments or obstacles to blocking this should be reminded, and the American people should be reminded, what they're stopping. This isn't complicated. It's whether or not millions of children are going to have health insurance or not. And one aspect of that care, or that health insurance, is a well-child visit. The other point I want to make in the early going today is that there's a good bit of mythology that surrounds this legislation, and sometimes facts are not put on the table. This is mostly a question of whether or not working families are going to have health insurance or not. There is a frustration now that so many families are living through now with the loss of a job, the loss of a home, the loss of their livelihood, and therefore their hopes and their dreams. The least that the United States Senate should do in the midst of what is arguably the worst economic circumstance in more than a generation, maybe the worst economy we've faced since the 30s. We can debate all that, but it's bad out there. It's real bad for families. The least that we could do is say, we may not have solved the larger health care challenge. We may not have fully debated all of the aspects of health care that we're going to debate, and I hope we can vote on, but at least we can take an existing program that we know works, that is battle-tested, that has results for 15 years now. My home state of Pennsylvania, when my father served as governor, he signed this into law. First big state to do it. He knew it worked. He knew it would work then, and he supported it strongly. It's worked in Pennsylvania. We have over 180,000 kids covered. This legislation would increase that to the point we could almost cover every child in the state, for example. But in the midst of this economy, the least that the United States Senate should do is say, we may not have solved all of our economic trouble. We may not have even solved significant aspects of our health care challenge. But the minimum that this Senate and this Congress and this administration should do is get this done, and get it done now. All these other debates are interesting and important, but frankly, some of them are academic in nature. I know they've risen to the level of conflict, and I know that the media likes to report on conflict. That's their job. But a lot of them, compared to what the gravity of what's at stake here, are academic, in my judgment. And I think for some, not everyone, but for some, are deliberately calculated to stop this legislation. Deliberately so. And I hate to say that, but it's just the way that I feel, and we have to be, we're getting down to the details now of getting this done. We got to be blunt and direct. So we're going to have debates about parts of this, but at the end of the day, the question is whether or not the United States Senate is going to provide millions more children with health care or not. That's the question. All this other stuff doesn't amount to, or doesn't rise to that level. They may be important debates, but doesn't rise to that level. So just one more point, and I'll yield because I know we have colleagues waiting. 78% of children covered by CHIP are from working families. Working families.